Well, welcome everybody to another recording here for the 2023 Cornerstone Annual Roadshow. We're very excited to be with Molina here today, Molina Healthcare, to talk about their 2023 benefits. And with me today is Michelle Phillips, the Broker Channel Manager for the state of Ohio. I'm Matt Fry with, Operations Manager here at Cornerstone. And, as we're going through this, if you're liking what you're seeing and you're not already contracted with Molina Healthcare, be sure to either reach out to myself, someone here at Cornerstone, whether it's our sales team, our service team, contracting team, anybody here, we're more than happy to help. So, with that, I will go ahead and turn it over to Michelle and kind of take it away with in regards to your 2023 benefits. Thank you.
Yes, my name is Michelle Phillips, as Matt had mentioned, and I'm going to just do an advanced screening of our Ohio products for 2023. I have some housekeeping things that I need to do, which is the disclaimer, because this is still not approved by CMS. We need to make sure that this material is not passed on to anybody else outside of just brokers and agents, because it is subject to change. So we want to make sure that you do not pass this on. It's just for training and educational materials for the brokers and not meant for sales or anything. As of October the 1st, 2022, we will bring out the information once it is approved from CMS. It will be made public at that time. So just a little housekeeping thing there. All right, a little bit about Molina. Our mission is we improve health and the lives of our members by delivering quality health care. And our vision, we distinguish ourselves as low cost, most effective and reliable health plan delivering the government-sponsored care. Now, our values, we do value our integrity and then also absolute accountability. And we are supportive with our teamwork, and that includes the broker as well, the managers, brokers, agents, and brokers that we work with, and also the uplines. We work as a team. So honest, and we're open, we have honest and open communications, and also the members and our community, and we're community focused. Now, Molina was founded in 1980, and we have a total of about a little over 5 million members as of May 22. We are ranked 125 in the Fortune 500, and we have about 19 billion in revenue. So, and it is a very established company. So we are national as well. Not only in the state of Ohio, but we have several other states, and you'll see the footprint as we go along here. Now, what makes us different is with Molina, what we use for some of our benefits in the state of Ohio, we do. Some states, it does not pertain to this card, but we use a debit card. It's a master debit card for benefits. It is preloaded with the benefits amounts on there for that member. And it includes the dental, vision, over-the-counter, transportation, also food and produce, and other benefits, as well as mental health and wellness application benefits for those who qualify. Now, I'll go into a little bit more as far as the SSBIC, which is the critically ill. Those type of benefits are, you see with the asterisks by them, that means that they have to be one of the critically ill beneficiaries. See that service. So as far as the dental product, by using our card, it allows them to go to any dentist, which is really nice. Instead of following a network, you can go to your dentist and utilize your benefits that way. Same with vision and over-the-counter, and in transportation. Again, this card is really great because you're allowed to use even Lyft, Uber, you can use taxis, you can use public transportation, bus, you can do rail, depending on where you live, whatever public transportation that accepts the Molina card, which is more or less a MasterCard debit card, will accept those way of utilizing your benefits. Right. This is our national 2023 footprint. Since I am, again, we are nationally, we're in a lot of states, but for right now, we're just talking about Ohio. Ohio actually has about 88 counties. we're currently in 81. So in 2023, we will actually have 83 counties that we are in, and that's all products that we have. Okay. So just a little look at the footprint. And again, we have 88 counties in Ohio, and we're in every one except for 5 counties. And those counties are Ashtabula, Belmont, Ross, Tuscarawas, and Wayne counties. Those are the only ones we are not in currently with all our products. Our 2023 products, counties are expanding to Hancock and Seneca County here in 2023. So with that said, the different products that we are currently going to have for 2023 would be 4 products. It would be the Molina Medicare Complete Care. It's a D-SNP plan. And then we also have the Molina Medicare Choice Care, and that's an HMO MAPD plan. And then the other one is a Medicare Complete Select HMO D-SNP. And then the 4th one would be the Medicare Choice Care Select. And that is another MAPD plan as well. So that's where we're expanding into with the state of Ohio, the 2 other counties, to make it a total of 83 counties that we are actually have our benefits in. All right, to go through the county, product information. This is again the 2023 product information that we're looking at here today. So the first one is our Medicare, a Molina Medicare Complete Care. It is a D-SNP plan. It is for full benefit beneficiaries. Okay, so it's Medicaid, full beneficiary, and Medicare. Those are the D-SNPs for this plan, or the beneficiaries for this plan. That's the QMB, the QMB Plus, LIMBY, and also the FBDE members that has that Medicaid, that type of levels in Medicaid. Again, we are in 83 counties, and for this plan, there is no copay, no premium for the plan itself. And of course, our primary care and specialist is 0 as well because of that dual eligibility. And then inpatient care is still 0. Prescription drugs would be 0 as well because they are full benefit. We do offer Silver and Fit. They can go to a facility or they can go to actually have activities done at home with Silver and Fit. And then we also have hearing, which is really a great product. It's routine hearing exam. They get 2 pre-select hearing aids for both ears each year. And then we also have what's called a pop-up plan. The pop-up plan is more or less, it has someone as a companion come into their home. They can even just be a virtual companion as well, but they'll come into your home and provide your clients cleaning, household, prepare meals, assist with some of the daily living activities that needs to be done. So that's a new thing, and it's a great product to have because, some of these beneficiaries really need that help, that assistance in that. So that's a great plan, portion of the plan. Also, they get the meals. If they are inpatient, once they are discharged, they get the 56 meals once approved. And then the dental. Again, the excellent things about our dental is that they can go to any provider because they're using that card. Anyone that wants to accept a debit card for payment will, more or less, they are able to have dental services done. So they get $3,000 a year, and that's both preventive and comprehensive. And then they also do the vision the same way as well. They get a $500 per year on the vision, eyewear, and exams. And then also the over-the-counter. Now, it's very, this benefit for the over-the-counter is very, very, it's generous, very generous. It's $470 per quarter. Now, it will not roll over to the next quarter, but $470 per quarter is quite a bit. They also have transportation, which is $100 per quarter. And again, it doesn't roll over, but that transportation allows them to use Lyft and Uber, the bus, or taxis. And I see a lot of beneficiaries actually use the taxi services to get to their doctor's appointment and so forth. But with that benefit, it's not just $100 towards medical transportation, but this transportation in general who would accept the debit card, more or less. So we also have the food and produce. It's $50 for this plan per month. It does not roll over. And again, they have to qualify for the supplemental benefit. For the chronically ill, there's certain diagnosis that fits that criteria. So they have to qualify that way for the food benefit for the $50. And then also they have the supplemental for the chronically ill rather, $150 per quarter, and that one does not roll over either. And that service actually gives them pest control. If they have a service animals, it will help them pay for food, more or less, or for that pet or that service animal. Mental health, wellness applications, and some non-medical covered genetic testing, stuff like that. It will help them cover, and that's $150 per quarter on that as well. And also pest control. I don't know if I mentioned that or not. Oops, oh, I'm sorry. I got to go back one. I apologize. The second plan is our DSNP plan as well. It is the Molina Complete Care Select, and it is our new plan for 2023. It is an HMO DSNP, but this one is particularly for the partial beneficiaries, people who qualify for partial benefits. That would be the Slim B, the QDWI, and the QI, which is the qualified individuals. Those are the people this plan is marketed to. And the premium is $0, doesn't cost them anything. For their primary care, it could be from $0 to $20, depending on their level of their partial eligibility for the Medicaid. So that's the reason why you have that difference between 0 to 20 on the specialist. Inpatients, you have $295 for the first 4 days. For the first 6 days. After that, they pay absolutely nothing for that stay, and that does include the hospital, the physician charges, and any lab work or x-rays that they have done there in that stay. $0 for the prescription drugs for tier 1 and 2. And because they are LIS eligible, some of them may be LIS eligible, tiers 3 to 5 may have a deductible depending on what level of LIS that they actually have, which is the low income subsidy provided by the state, or how much they actually have for copay. So that still does apply for the partial duals. Now, fitness, we again have the Silver and Fit that allows them to go to any of the facilities to participating, and also home kits where they can do it at home. They have routine hearing exam, up to 2 pre-screen hearing aids for both ears each year. And then again, they have the pop-up plan that helps them with, like I said, household chores and things of that nature that will help their quality for their daily living activities, and then also companionship as well. One thing we do know with COVID, there's been a lot of people who would seem to be isolated, so that would be very helpful to make sure there's someone there to check on someone for that pop-up plan. And I am saying Papa, like in Papa, so not Pop-Up. But anyway, the meals still, after approval, is $56. After an inpatient stay, when they're discharged, they get 56 meals on this plan as well. They have the $3,000 for the dental as well. Again, they get the card too. They use the Molina debit card for that and get to choose their own dentist. And then same thing with the vision. They get $500 for their eyewear and exams. And then for the over-the-counter, again, they get the $470 per quarter, which is very generous again with that over-the-counter. And they are using that card. All that is on that card preloaded for them once they become a member. And I'll discuss more about how they become a member as well. Transportation. $100 per quarter. Again, it does not roll over, but again, they have that access to any public transportation that they want to use. And then also they had the food and produce eligibility of $35 for the partial plan. And again, they have to qualify for the chronically ill diagnosis in order to get that service. And the same with the other SSBCI benefits, as $150 for the pest control and so on and so forth, with the mental health and the other services that's offered through that one as well. The next plan is the Molina Medicare Choice Care. This is our MAPD plan, and all are eligible for this. This is all CMS eligible people that are able to get our plan for this. There is a zero premium, and their PCP is zero, and the $20 copay for specialists. And that's really a great copay to have. It's very competitive with other products that are out there, very low copay for services. Their inpatient stay is $295 for the first 6 days, then zero after that. They don't pay anything from 7 to 90. Again, it includes the lab and physician charges as well. The prescription drug, zero copay for tier 6. And somebody might ask, what is a tier 6? Because some of the other plans don't have, they can just go 1 through 5. Tier 6 is more or less a subset of tier 1 prescription drugs, preferred generic drugs rather. And so tier 6 is just a subset of that, but it is zero for tier 6. And then $125 deductible is applied to tiers 1 through 5. And Part D Seniors Savings Program, there is a $35 max on insulin. So that's always great to know that, you know, that cost for that expensive insulin is going to be capped at $35 per month, which is nice to know. And then we also have the Fitness Silver and Fit program for them as well, and they can have their exercise or go to the facility or home exercise. The hearing benefits, they also get the 2 hearing pre-selected hearing aids for both ears per year. And then, of course, the pop-up plan, they get that as well to help with their daily living and some chores and meal preps and items like that, and companionship. And then meals, again, for the inpatient stay after they have been discharged. And then dental, $2,000 on their benefit card, their My Choice card. And they can, again, go to any dentist. And vision is at $200 per year. And that's for their eyewear and their exams. And then the over-the-counter is actually $115 per quarter, and it doesn't roll over, but it does combine both the over-the-counter and the transportation. So you have to keep that in mind. It's a little different from the D-SNP. The D-SNP, of course, was a little higher, generous on the over-the-counter, but this one is combined with the transportation and the OCT are combined, but it still allows them to go to any provider that will accept that card for transportation and OCT, as opposed to ordering through a booklet or something like that. They can actually go to Walgreens or any place like that to use that benefit. And then also the produce and food card, $50 per month if they qualify as a chronically ill diagnosis. And then same thing, that's $50 per month. It does not roll over. And then the other benefits for the chronically ill would be $150 per quarter as well for those services like the animal supplies, pest control, and then some of the mental health and testing, genetic check testing for those. All right, so the next product, this is new for 2023. This is, again, another MAPD plan. And basically what this is a buyback plan. So we're excited about this plan here because it pays back their premium for $75 on their Part B premium, which is really great. And this target market are going to be those who more or less are coming off of the marketplace plan, age 65. They just aged in, and they don't really want to pay that $200, almost $200 on, it will probably be in 2023, $200 for Part B. So this actually cuts down the cost of their Part B premium. So this is the buyback plan. We will pay up to $75 for that Part B premium. So there is no premium to enroll in this plan. So they won't have a monthly premium with us. And the specialist copay for the primary care is $0. The specialist copay would be $50. If they are have an inpatient stay, it will be $450 for days 1 through 4. After the 5th day, then there's no copay for that. There is a deductible of $375 for tiers 1 through 6. And of course, this senior savings plan, the $35 max on the insulin is on this plan as well. They have access to the Silver and Fit, so therefore they can go to the facility or home exercise kits they can utilize. There is no hearing benefit on this particular plan, but they do have the pop-up pals that can have the daily living activities help them or assist them in any way, or companionship with cleaning and household chores as well included. And then there is no dental added to this plan and no vision, but it does have the OCT and no transportation, but all $115 for the OCT on this particular plan. There isn't, because these people tend to be a little bit not categorized as chronically ill, there's no benefits for the chronically ill as well for food or produce, nor is it for the additional benefits for the chronically ill. All right. Right, just to highlight a few of our network providers. This is not our providers. We have a lot more, but just wanted to let you know, for like in the Central Ohio area, the James Cancer Hospital is in our network. Also OSU Hospital, OSU Physicians as well, Ohio Health Physicians, and Ohio Health System as well, the hospital system as well. For those in the Cleveland area, there's the University of Cleveland hospitals, and then also Summit Health Hospital, Summit Physicians. And then we also have Mercy Health, and that's statewide, wherever Mercy Health is located in the state. They are participating with us as a provider. And we also have the Mercy Health Physicians in Cincinnati as well. And then the University of Cincinnati Physicians and UC Physicians in Tri-Health. And then in the Dayton, and that area is Kettering Health Network as well. All right, this is how, just to go over briefly how the My Choice card for the additional benefits work. What they do is once they enroll in the plan, they complete the HRA, and this is the important part about it, them completing the HRA or you completing that HRA for them. You are paid $100 by Molina for each HRA you actually complete with that member, okay, or with that applicant. So if you're looking at a new to Medicare, that's almost $700. And then if they're renewed, that's almost $400. So it's worth doing it. It's definitely, because it is $100 per HRA. And then once they get their membership card, and then their My Choice card will be sent to them separately. The member activate the card through our member services, and then they can request the benefits review to see if they qualify for those SSBI-CI benefits, the chronically ill benefits. They can check with them at that time if they qualify for those additional benefits, like the food, produce, and the additional benefits add-ins for chronically ill. I keep saying critically, but it's chronically. And then the card is actually loaded automatically for the standard benefits, but once they qualify for the additional ones, then it's actually loaded in for the additional benefits as well, like food and produce if they do qualify. So if they need to go to the dentist or something, they can start their appointments, get their appointments scheduled right away, because the card is for standard. Dental is standard on the plans that actually offers the dental. All right. And our member services, as I mentioned, that's who they would contact. So when the members, once they become a member, the member services would just need the 4-digit ID number off the card, and they don't use the Social Security for security reasons. And then they can also call our member services for the balance on each allowance. They can check the purchase totals and location or reason why it was declined. They can check that. They'll be able to tell them anything about their card. They can access their mailing status. If they haven't received their card, member services can actually follow up to find out what happened to their card. And then also issue replacement cards if they lose them, because it is a debit card. It's just like, tied to a bank. So you want to make sure that they have access to the information that the benefits that are on that card and how much at all times. Now here's the important part. This is where the broker resources I'm excited about. Please come and see me. I will be there in Cincinnati and Columbus and Cleveland and also Toledo. So please come and see me, because we would love to see you get certified with us and get ready to sell. We're excited about these products, so we can't wait for you to definitely come and get on board with Molina. Now, if you complete your AHIP and you're certified or contracted with us, we're offering a $50 discount. Once you pass the test, once you use our link for the AHIP test and then pass, we will reimburse you the $50, or you will be not reimbursed, but you would be the cost would be deducted $50, so that way it would give you a rebate on that. And then to get contracted, you just need to contact your upline for that. Let them know you're interested in contracting with Molina. And then once you get your contract information sent to us and we get it processed, we'll send you a link for the certification, and then you can be ready to sell. So we're trying to make it as easy as possible. You will get an email notification to let you know, hey, you're ready to go. And we're just excited to have you on board. So anything we can do to help, just, let us know. And with that said, we even have more resources for you. If you want training, say that your upline or does not have Sunfire or some other system to put applications through. I know a lot of brokers ask, how do I get my applications through to you guys? So we have our MAC Center, is our Molina Agent Center. We have a lot of resources here for you. Some training to let you see how you can put an application through our electronic process. We have training on the products. If you want to know the DSNP better world, if you're not familiar with it, you want to know more about it. There's events on this page. There's a lot of resources for you once you become ready to sell with us. So just plot a lot of information that we are giving available to you. And here are our business unit, our broker service unit, and they're here for you as well. So it's kind of like a concierge service. Their actual hours are 6 a.m. to 6 p.m. Monday through Friday. It may extend during AEP, but you will be notified if they do. And then they can check your eligibility for you. If you have an issue with trying to make sure your applicant is eligible, they can do that. They also have the ability to do the SOA and also your enrollment by telephonic. They'll record it for you, which is great. They have the care team helping you with your members. If your members got any questions about something, you can contact them about that as well. And then also the broker, pharmacy, and the provider lookups. If you need anybody looked up that you can't seem to locate in our online lookup or directory, you can call and ask them for that. You can order marketing materials from them. And then contracting and certification questions as well. This is a great unit to get involved with. That telephone number is 1-866-440-9788. And it's broker@molinahealthcare.com. That's how you can reach them. All right. Now, just to go over some enrollment options, what we accept, we still take paper applications, but you would have to have an enrollment kit. So you need to order enrollment kits if that's the way you want to submit your applications. You would be able to submit the HRA as well by paper as well. But again, you would need that envelope in that enrollment kit in order to do so. But if you choose to fax it to us, we will accept a fax as well. It's 844-541-6848 for fax. And then we do electronic enrollment through our DRX connector site for 22 applications. The link is still active right now. There will be an active link starting October 1st for 2023. We don't want anyone jumping the gun or becoming uncompliant by trying to submit applications prior to time that CMS allows. So with that said, we do offer training, how to get the application in through our system, how to utilize our system as well. Our broker service unit will assist you again, like I mentioned, with the telephonic scope of appointment or enrollment. So they record the conversation for you and record the application process for you. That way you are still in compliance. The telephonic scope of appointment has a different number than the enrollment. The scope of appointment number is 1-844-855-3948. And then the telephonic enrollment is 1-866-714-8996. And we also utilize your upline sites as well. They use Sunfire or some other type of system. We are compatible with using those as well. Our provider online.
Sorry, Michelle, I didn't mean to interrupt there, but on that last slide, all of our agents do have access to enroll into Molina through our Medicare Center tool.
Okay.
And I just wanted to make a comment.
Is that Sunfire? Or is it?
It's actually both. We have a tool through Connecture as well as Sunfire through a single point sign-on through our Medicare Center.
Okay. Did you need me to rephrase that or?
No, you're good. I just wanted our agents to just, I wanted them to hear all of the information that you gave, but just while we were on that topic, I figured I'd just chime in there. I hope you don't mind.
Nope, you're good. Nope, I'm glad to find out that because, and we do training on ours just in case, because a lot of them that don't have that kind of access to, to get the applications online. So we try to just open it up to everybody. So.
Great. Thank you.
You're welcome. We have important links to tell you about. That's our provider online directory as well. And then our formulary lookup tools, and also our Molina Mac Center. Again, that's the Molina Agent Center. And that's to get contact information, training, events for training, and then other resources that we offer. And then we also have the broker portal where you can go and look at your book of business and look at your statements as well. So you have access to that as well. All right, so right now we're in 2022 still, and the third quarter for D-SNP is still available to you guys. So if you're ready, if you get ready to sell like this week or next week, you still have September to still get some book of business in. So get some business in. So the dual SNP, as you know, their election period is quarterly that they can move. So if you got anybody coming in that's dual eligible or LIS or some type of SEP that you can use for the third quarter would be great. We welcome that. Again, you want to take advantage of that HRA. There's an extra $100, so that's close to $700 for someone new. Renew $400. People who recently gained or lost Medicaid, that's still out there available for people to write business on. And then recently gained or lost coverage as of, due to their dual status. Maybe they lost the dual status because they made too much money at one point in time, or their LIS because they made too much money. New to Medicare, their ICEP is available. And then any recently left their employer coverage or union coverage, and recently, or people, and I thought about that, recently, people who just released from incarceration, there's all kinds of community services that help people who are coming out of prison. That's probably a good place to market, for people who are just coming out because now they're eligible. Then recently moved to the new area. Of course, that's a SEP that you can always use, and then recently moved in and out of an institution. So we still have September. Please, continue to write business. We're talking about 2023, but the year's not over here yet. I know a lot of people are on vacation, but it's time to get back to work. Okay. Some important telephone numbers for member services. For the Ohio member service, this is all of them, but for the Ohio member services, if you need to ask them any questions, you still have the broker service unit to ask questions in regards to broker-related questions. But if you got member-related questions and you need to give them the member number, it is 866-472-5484 is the number for Ohio. And this is the team for the Northeast region. My supervisor is Britt Paulson. She is the regional sales director. And if you're interested in Illinois or Wisconsin, many of you have multiple licenses in multiple states. Luke Stecker is our BCM, our broker channel manager there in Wisconsin and Illinois. Illinois is a new state, so it has to be ripe for the picking on that one. So you might want to look into that. And then right now we have no one in Massachusetts, so Britt, my director, is actually handling that. And then for those who have a state license from Michigan, Jonathan Roden, he is the broker channel manager there. So, and then of course there's me for Ohio. And my information, if you can't see it, it is Michelle.Phillips, number 2 at molinahealthcare.com. That is my email address. My telephone number is 614-802-9819. Again, I'm excited for 2023. I hope you guys are too. We've got some really great products out there, and let's do business.
Well, thank you very much, Michelle, for going through all that information.
Yeah.
You know, I really appreciate that. And just as I mentioned to start the meeting, I'll mention it again. If you like what you saw and you want to reach out to us in order to get contracted with Molina, yeah, definitely go out to our website, click the Contact Us page, and just reach out to anybody here on the team, and we'll certainly help you out. So, yeah, thank you again, Michelle, and, you know, everybody, have a good rest of your day. Thank you.
You too. Thanks, Matt.